There's significant benefits for thrombolysis, as we've actually seen. We started the service about a year ago now in December 2009, and we've had some significant outcomes from it. The patients come in with the symptoms, have their treatment, are actually discharged from hospital after making virtually a full recovery in some instances and returned home.
My name is Christopher Trotman, and I had my stroke on the 7th of July. I was in the conservatory and I went to bend down and I couldn't get back up. I remember being in the ambulance going down to Newport, and I remember a bit after, but it was all confused for the first 2 hours it was. And I was told later on about this new drug it was.
My name is Leonard, Sully. I didn't know there was anything wrong with me. It was my wife spotted. She could see there was something wrong with me. She was saying to Leonard, "What's wrong with you?" I said, "There's nothing wrong with me." She said, "There is," she said. And as I was speaking to her, I couldn't get the words out. The treatment I had was, I had it straight away and it done the job like.
But they do say that it's up to 80 it is, you have it, but I'm 81. And they give it to me because I was in good condition when I come in, that's what it was, so they said. I'm back to fitness. I drive the car after 6 weeks. I drive the car, and I play golf now since. So I'm all right. I'm back to normal, really, you could say.
I felt as if I could go out and mow the back lawn when I got home, but I wasn't allowed to. The boss stopped me.
I have particularly seen a lot of improvement in stroke care. Patients are assessed quickly, brought to the stroke ward quickly, assessed by various therapists, physiotherapists, occupational therapists, speech and language therapists.
We are now achieving 100%, so everyone that comes into the Royal Gwent Hospital is getting to the stroke unit within 24 hours.
And that overall, it has improved hugely the patient care, and the patients are seen quickly and they are discharged quickly.
Every patient that comes through either A&E or the admissions wards is referred to ourselves and is seen on the admissions wards.
Because when the patient gets assessed, have these assessments very quickly, they get home quickly as well. So we have seen the length of stay has dropped significantly.
Patients in the earlier bundles are coming up to the stroke unit far quicker, which means that our assessment of them is earlier than what it tended to be before. So because the earlier bundles are succeeding, it's actually helped us to achieve our 7-day target bundle far more easily. So they're getting a far better timely input from us. We can often assess them quicker, which often means that we can get a treatment plan in place quicker and often discharge plans in place quicker as well.
By reducing the length of stay, they must have almost saved millions of pounds in a year's time. Recently there's a talk that length of stay has dropped almost 13 days in a stroke ward. It's not only that you save the money, it's also you give the patients a better place in their own home. No one would like to stay more than a single minute in the hospital when you feel you are eligible to go to the home. Once you are fit enough to go home, you need to be at home. You don't need to stay in the hospital.